The COVID-19 pandemic has been a stark reminder of our global vulnerability to infectious diseases. As the virus continues to circulate, the possibility of new variants and surges remains a constant threat. One of the most concerning scenarios is the potential for healthcare systems to become overwhelmed, a state of oversaturation where the demand for medical care, particularly hospital beds and intensive care, surpasses available resources. Oversaturation has dire consequences for everyone. When hospitals are stretched to their limits, the quality of care for all patients, not just those with COVID-19, is compromised. Waiting times for emergency care increase, surgeries get postponed, and routine checkups may be delayed. This strain on the healthcare system can lead to preventable deaths and long-term health complications for individuals with both acute and chronic conditions. The oversaturation of hospitals also has a profound impact on healthcare workers. Doctors, nurses, and other frontline personnel face immense pressure and burnout as they work tirelessly to care for an influx of patients. This can lead to staffing shortages, further exacerbating the crisis. The emotional toll on healthcare workers is immense as they witness firsthand the suffering and loss caused by the pandemic. The consequences of COVID-19 oversaturation extend beyond the healthcare system. Lockdowns and other public health measures, while necessary to curb the spread of the virus, can have significant economic and social repercussions. Businesses may be forced to close, leading to job losses and financial hardship. Schools and universities may shut down, disrupting education and childcare. Social isolation and mental health issues can also arise from prolonged periods of lockdown and uncertainty. When the COVID-19 pandemic first gripped the world, the focus was understandably on treating those infected with the virus. However, as hospitals filled to capacity, a concerning trend emerged: an increase in mortality rates for individuals suffering from non-COVID-19 related illnesses. This collateral damage highlights a crucial aspect of pandemic preparedness: the need to maintain a robust healthcare system capable of handling both the surge in infectious disease cases and the ongoing needs of the general population. The elderly, often grappling with multiple pre-existing conditions, are particularly vulnerable during periods of hospital oversaturation. Their need for timely medical intervention, whether it be for heart attacks, strokes, or complications from chronic diseases, doesn't diminish in the face of a pandemic. Yet with resources stretched thin, these individuals may face delays in treatment, leading to poorer outcomes. Cancer patients, already facing a challenging journey, are also disproportionately affected by hospital oversaturation. Chemotherapy and other life-saving treatments may be delayed or interrupted, jeopardizing their chances of recovery. The pandemic has also led to a decline in cancer screenings, potentially resulting in later diagnoses and more advanced disease stages. Mental health, often overlooked in the midst of a public health crisis, is another area where the impact of COVID-19 oversaturation is deeply felt. Individuals struggling with anxiety, depression, and other mental health conditions may find it harder to access therapy and support services when hospitals are overwhelmed. The isolation and uncertainty brought on by the pandemic can exacerbate existing mental health issues and lead to a rise in suicidal ideation. Pregnant women face unique challenges during a pandemic, and COVID-19 is no exception. While pregnancy itself does not appear to increase susceptibility to the virus, it does increase the risk of developing severe complications from COVID-19, including hospitalization, intensive care admission, and even death. This heightened risk is attributed to physiological changes during pregnancy, such as decreased lung capacity and a suppressed immune system, which can make expectant mothers more vulnerable to respiratory infections. One of the concerning aspects of COVID-19 in pregnant women is the potential for misdiagnosed or delayed diagnosis. Shortness of breath, a common symptom of COVID-19, is also a normal physiological change during pregnancy as the growing uterus puts pressure on the diaphragm. This can lead to pregnant women dismissing early signs of COVID-19 as pregnancy-related discomfort, delaying seeking medical attention, and potentially allowing the infection to progress to a more severe stage. Another risk factor for pregnant women is silent hypoxia, a condition where oxygen levels in the blood drop dangerously low without any noticeable symptoms such as shortness of breath. Silent hypoxia can be particularly dangerous during pregnancy, as it can affect both the mother and the developing fetus. Early detection is crucial to prevent complications, and home pulse oximetry, a simple and non-invasive way to measure blood oxygen levels, has emerged as a valuable tool for expectant mothers. The pandemic has also had a significant impact on prenatal care. Many expectant mothers have experienced disruptions in their routine checkups and appointments due to lockdowns, hospital restrictions, and fear of exposure to the virus. This disruption can have consequences for both maternal and fetal health, as early detection and management of pregnancy complications are crucial for optimal outcomes. As we navigate the ongoing challenges of the COVID-19 pandemic, one thing remains clear: vigilance is key. The virus continues to evolve, and the emergence of new variants underscores the importance of ongoing research, surveillance, and preparedness. We cannot afford to let our guard down or become complacent in the face of this global health threat. Continuous research is essential to deepen our understanding of the virus, its long-term effects, and the development of more effective treatments and vaccines. We need to invest in research that explores the long-term consequences of COVID-19 infection, particularly in vulnerable populations, to develop strategies for mitigating any lingering health issues. Surveillance systems must be strengthened to rapidly identify and track new variants as they emerge. Genomic sequencing, a powerful tool for monitoring viral mutations, should be implemented widely and data shared globally to facilitate a coordinated response to emerging threats. Early detection of new variants is crucial to developing updated vaccines and implementing public health measures to prevent widespread transmission. Preparedness is not just about having enough hospital beds and ventilators. It's about building resilient healthcare systems that can adapt to surges in demand without compromising the quality of care for all patients. This includes investing in telehealth technologies to expand access to care remotely, strengthening primary care systems to manage chronic conditions effectively, and ensuring an adequate supply of essential medications and medical supplies.